Hi everyone, Shayna here from Therapeutic Bridges. I am a licensed clinical social worker based out of Los Angeles. I just went into private practice, and so I'm launching my new YouTube channel and Instagram page. And so for my first YouTube video, I wanted to talk a little bit about why you and really everyone needs to be in therapy or should be in therapy. Not only has it been a really difficult year with COVID and increased prevalence of anxiety and depression among the general population, therapy is also just really great in terms of caring for yourself holistically. So, very often we focus so much on physical health and what's going on with our bodies, and really, the conversation has been lacking in terms of what are we doing for our mental health and to keep our mental health strong. And there is a connection between, what happens physically and what happens to us emotionally, and vice versa. And so, really, I'm my life goal has been to try to push this conversation forward that mental health is just as important as physical health. And seeing a therapist does not mean you're crazy or that there's anything wrong with you. That's just simply not accurate. Growing up in the United States, I've witnessed that really there was this sort of stigma around therapy that if you were going to therapy, it meant that you were broken or there was something wrong with you. And that's simply just not true. Really, I think everyone and anyone can benefit from therapy. Going to therapy is a scary process. You feel very vulnerable and raw and open. It can be really difficult to open up to a stranger that way. Um, but many people who go to therapy for the first time find that actually there's a lot of benefit talking to a stranger because the stranger is able to be much more um, objective, about your life, and might be able to provide a different level of support than friends and family can. Um, and so, going to therapy can feel really scary, but it really is a beautiful thing. It does require work. It requires, mental, emotional work. I often tell patients that going to therapy is similar to going to the gym. So if you go to the gym, you're going because maybe you want to lose some weight or you want to get some six pack abs or whatever it is. Um, and so you're going to the gym to exercise your muscles. In therapy, you're exercising your mental muscle, your emotional muscle. And at first, just like going to the gym, it can be really difficult. You might feel kind of sore after. You might feel like you're not sure why you're doing it in the first place, but if you stick it out, similar to exercise, you will see results over time. And I really think that therapy is one of the best gifts that you can give yourself, truly. So, what to expect at your first therapy session? So, your first therapy session, you will meet with your therapist. They will tell you a little bit about themselves, their theoretical orientation. You will sign some consent forms. Traditionally, in therapy, everything is confidential unless the therapist is concerned about your safety or the safety of someone else. Those are instances where um, things cannot remain confidential. The therapist will then conduct an assessment. So they should be conducting a biopsychosocial spiritual assessment where they're taking a look at kind of all the things going on with you, all the factors that might be exacerbating your stress. They'll talk to you about how you're sleeping, how you're eating, any symptoms that you're having of any, emotional distress. They'll want to get history, uh, background information on your family and your childhood and your relationships and your support system. And once they're able to gather all of that information, then they come up with a treatment plan for you. And you should definitely be involved in that treatment planning process. And so that looks like discussing sort of what your goals are for therapy, what you want to get out of it, and really how do you know that therapy is working. So I very often ask patients when I see them for the first time, what they want their life to look like after therapy. What is it that they're hoping changes, maybe within themselves or with relationships? And help me paint a picture of what that would look like for you. So that's something your therapist should also be working with you on. Thank you for listening today. Please stay tuned to my channel for more informational videos, and you can drop a comment in the comments section. Let me know what else you want to hear about. I'm always open to sharing any type of knowledge or insight that I have on any issues that you all want to hear about. Thanks. Bye.